As we're studying various types of eukaryotic microorganisms, both unicellular and eventually multicellular, we need to include a category called neglected parasitic infections, all having to deal with different types of parasites in that eukaryotic microorganism group. Several of these are single-celled types of eukaryotes, and others are essentially helminths. As we're talking initially about the eukaryotic unicellular microorganisms that are parasitic, those are the ones that catch our attention and that we're focusing on in our course this semester, we need to mention perhaps a few others that we're going to add to our list, and that would include organisms like Trypanosoma cruzi that causes Chagas disease, in addition to Toxoplasma gondii and Trichomonas vaginalis that we already have talked about or described in our previous lectures, our previous recordings. In addition to those unicellular eukaryotes of Trypanosoma, Toxoplasma, and Trichomonas, we'll also include two helminths, Taeniasolium and Toxocara, Canis and Cati, in that list of organisms that cause essentially parasitic infections, all of which on this list, according to the Centers for Disease Control and also even the World Health Organization, are parasitic infections that can cause severe loss of productivity, mortality, morbidity in human populations, but could be in fact, with some diligence, reduced or maybe even eliminated in the human population with appropriate health sort of management or even environmental management to make certain that we don't encounter these parasites. We'll discuss all of these different types of eukaryotic parasitic organisms in our unit this semester, and in terms of any one of these 5 examples, 5 to 6, of 2 species of Toxocara, anyone can become infected with any of these parasites. Generally, it has nothing to do with sort of how much money you have, or perhaps even where you live, though folks who are living in crowded, unsanitary conditions, oftentimes refugees, immigrants, folks that, even working folks that are financially disadvantaged, tend to be more at risk because perhaps they're more often exposed, especially people who have to live in unsanitary conditions. And those folks, all of them, are the ones that the Centers for Disease Control and the World Health Organization are trying to protect from these health threats by making everyone more aware of the increased prevalence of these types of parasites. Once we increase awareness, especially with the public, with patients who might be exposed, we also have to educate and inform healthcare providers, including physicians, all kinds of clinicians. We need to make certain they understand that, yes, indeed, even though we might live in an urban area, don't think that we get exposed to these types of parasites, yes, indeed, we can be exposed. The Centers for Disease Control are in the process, and have been for many years now, gathering numbers, finding out who's infected, where they live, what their backgrounds are, where they're working, trying to improve management of these huge databases to understand these types of parasitic infections, and also improving diagnostic testing, which has improved dramatically in the last 10 years or so. Make certain that clinicians and medical centers have good information and education on types of treatments as they quickly become available, and making certain that drugs are available to treat these types of parasitic infections, since they're oftentimes maybe not the first ones that are at the top of the list to treat patients with. For example, in Northern Virginia, there's a fairly large population of folks who are at higher risk for having Chagas disease because of the international travel that they've had. And you wouldn't think of Chagas disease being a higher incidence or prevalence in Virginia, but it is. And that's true of many types of parasitic infections, especially the ones on this list, in different parts of the world where you just don't always think that that's going to happen there.